What robotic-assisted surgery does is allows the experienced surgeon to be better.
It's so accurate that it means that we can really plan and execute perfectly. Hello. So, today's the day we finally get to fix your knee using the Mako robot.
There's no doubt that we've got a fantastic operation in a hip replacement, as it is done now. But the expectations of patients has changed dramatically in the last 2 decades. Patients don't just want to be relieved of their pain, to tie their shoelaces. They want to return to unrestricted activities.
Patients now want knee replacements which are highly functional, which allow them to bend down and play with their grandchildren, to go for a walk.
They want to play golf, they want to be able to play tennis, and they want to feel like they did when they were younger.
Which means that in 6 months' time, when people say to the patient, how's your knee replacement? They look slightly bewildered and say, oh, you mean the one I had replaced? Oh, it's fine.
And that's putting an onus on us as a surgeon to reproduce the natural joint. And also quite a lot of pressure on the implants to deliver that.
Up until now, we've used instruments and jigs to help us put a knee replacement in what we think is the right place.
It's just been the surgeon's experience of going from one size to another size until they feel it's the right size component for that patient.
And so what we really want is to try and personalise for that individual patient.
With robotic assisted surgery, patients have a CT scan. The CT scan makes the planning more personalised. For that patient, it's their scan.
So there are great advantages to the patient. It means they get a personalised plan that is accurately and consistently carried out. So I'm now attaching the arrays to allow the robot to see where the leg is.
During the operation, the computer helps the surgeon decide whether the bone is cut.
The robot doesn't make the cuts itself. I control the robot arm.
The computer knows to a 1mm or 1 degree accuracy where you are, which is far greater than even an experienced surgeon can do just by looking. And during the operation, the robotic assisted arm is giving you instantaneous feedback as to where you're putting those components.
So it can tell where the knee is tight or loose. And what this machine is telling me is that this gentleman cannot fully straighten his leg. It also says that his leg is bowed. Neither of those things we want. And that's one of the most important things to understand. We start off with a plan which we then modify. It responds to the situations in surgery.
So you can look at the screen and say, if I do this, this is what the outcome is going to be like.
We can now bring the robot in, which will help me execute that plan with a high degree of accuracy.
The robot is checking all the time to make sure that the components are being put in the planned position. So it is stopping the surgeon doing something wrong during the operation.
When it suddenly stops, it's telling me that I can't do what I'm about to do. That's the beauty of the robot. It stops me doing things that shouldn't happen.
So you can be sure at the time of surgery that you're being as accurate as anyone can be. So even in the experienced surgeon, we can make them better.
So with the final implants in place, and what this tells us on the machine is that from a knee that he couldn't straighten, it is now straight. From a knee that was once bowed, it is now straight. We've had to do no ligamentous releases, and this gentleman should have a great recovery. The truth of the matter is, having seen some of the results, when I use this tool, I can put them in better than I've ever put them in before.
There will be less soft tissue damage. That means there's going to be less bleeding. That is going to reduce the amount of swelling they get afterwards. It'll be more comfortable when in those first few days when they're getting over the operation and actually allow the patient to recover quicker.
I personally think this is the future of joint replacement surgery for hips, knees, maybe other joints as well. I'm very lucky to be able to have one. I think personalisation of surgery is where we need to be going, and I'm absolutely certain that you will see a huge take-up of this technology in the future, because for patients,
To have a personalised knee replacement and great function at the end, that's what we're aiming for.